Good evening, everyone. I'm Dennis Stone, Director of the Center for Advocacy and Social Justice at the Jacksonville Urban League. I want to welcome everyone to our session on housing, and I will turn it over shortly to Muskan Patel, who's part of our contingent of interns for this fall at the Urban League at the Center for Advocacy and Social Justice. We're very pleased to have this group every semester who really put on some fine programs as well as help us with other activities and also develop policy papers that focus on the needs of underserved communities. Also want to thank Sadia Barge, who's the coordinator of our internship program. But let us get to the heart of the hour, and I'll turn it over to Muskan Patel.
Uh, Good evening, everyone, and thank you so much for joining the Housing Town Hall. It is truly an honor to welcome two exceptional leaders whose work has shaped public health, social policy, and community well-being across Massachusetts and the United States. There's so much I could say about both of our speaker, but due to the time constraint, I'll keep my remarks brief. So, our first speaker for this evening is Professor Harold Cox. Harold Cox is a professor of practice community health science at Boston University School of Public Health. Trained as a social worker, he has decades of experience in public health, including work in HIV, AIDS services, homelessness, developmental disabilities, and local government leadership. At BU, he has taught leadership, overseen the MPH practicum, served as an associate dean of practice, and founded the Activist Lab to engage students in community action. Before joining BU, he spent 10 years as a chief public health officer for the city of Cambridge, where he led the effort to make Cambridge a tobacco free city and helped organize a regional smoke free workplace. He also strengthened emergency preparedness, supported literacy and youth programs, and previously worked with AIDS Action Committee. He continues to volunteer in Boston Homeless Shelter and is also widely recognized a storyteller featured on The Mouth and PBS stories from the stage. Our second speaker is Dr. Stephanie Edinburgh D. Cuba. Dr. Edinburgh D. Cuba is Executive Director of Children's Health Watch and Research Associate Professor at School of Public Health and Chobanian Advision School of Medicine. She has more than 2 decades of experience studying the social drivers of health for young children and families, including housing, food insecurities, immigration policies, and environmental conditions such as extreme heat. Her work focuses on how these factors shape early childhood health, development, and family well being. She has published extensively, and her research directly informs state and national policy efforts to improve housing and economic stabilities for families. Please join me in welcoming Professor Harold Cox and Dr. Stephanie Edinburgh de Cuba. We are so grateful uh, for for your time and expertise, and we look forward to learning from your insight today.
Oh, I think you want me to speak now.
Yeah.
Okay, all right. Hello, everybody. And Muskan and Dennis, thank you so very much for the opportunity to be here with you today. I want to spend a little bit of time with you in talking about where I work and about some issues around homelessness. But I want to talk about it in the context of where I work. I'm going to share some slides with you to give you some pictures of what this actually looks like. Am I sharing?
Yeah, there's two of you though, so I don't know if there's a way to just make it Harold slides.
Okay. You mean one of me is enough? Is that what you're seeing?
We love you, Harold.
Okay, all right. I just wanted to be sure it was let me see if I could just make one of me.
Yeah, now we can see your slides, but we're seeing the slide sorter view.
Is
Yeah, there
that
it is.
is this is
Perfect.
that
Yep.
better? Okay, great. All right. So I'm calling my presentation "Life on Albany" because my school is on Albany Street, and the area that I want to talk about is on Albany Street. I'm in Boston, Massachusetts. This is the place that Stephanie and I work. It's the School of Public Health. This is a building that was built in the late 1800s. It's an incredibly beautiful Victorian Gothic style building and was one of the very first hospitals that was built in this area. It used to be a homeopathic, a hospital of homeopathy. And now it's the School of Public Health. So on this campus, along with us, is a very large hospital system, the Boston Medical Center. There is the Boston University School of Public Health. There is the Boston University School of Medicine. There's the Boston University Dental School, and that there are a number of laboratories around. So it's a very large area that is an educational center as well as a medical center. And our and we love this building. I think Stephanie's office is in this building. My office is not in this building at this time, but I'm close by, but I'm in it all the time. We are housed in the section of the city called the South End. These are row houses that are in the South End. And the interesting thing about these row houses is that the South End is a very expensive place to live. You could buy just one floor of one of these buildings, and it would cost you about maybe 1,250,000 dollars. So it's not cheap. You could buy a whole building, which would be like 5 floors, and it'll cost you somewhere about $3 to $7 million. So it's not cheap. The area that we live in is incredibly beautiful, but you might imagine that with housing that costs this much, you are talking about people who have relatively high incomes. We also have right adjacent to all of these very expensive housing, also a low income housing development. This is a development that is just adjacent to all of those row houses that I just showed you. And there are about 300 units of housing that is here. So the area is complicated in that you have both very high income folks. You have also individuals who are also incredibly poor. Also, in this area, the circle that is circled around is the general area that we are living in, that we are working in. And there are a number of programs for people who experience homelessness, who experience mental health concerns, and who have substance abuse disorder. And these are all, and so you can see this area is now becoming fairly complicated. We've got this incredibly beautiful building that we work in. We have a very expensive set of housing that's there. We have some low income housing that is just adjacent to all of us. And in addition, there are many services for individuals who experience homelessness, substance use disorder, as well as mental health concerns. This is just adjacent to all of the buildings that I've just mentioned to you, and this is a homeless shelter. The arrow pointing to the left. The arrow that is pointing down is actually the county jail. And I show you all of these because I want you to get the sense of just how complicated this area is that Stephanie and I work in. About a block away, there is another homeless shelter. This one is for men. The first one that I showed you, going back a slide, this particular shelter is for women. There are about 200 women who live there. There are about 400 men who live in this particular shelter. And then among all of this environment, there are many homeless individuals. So we've got this incredibly complicated environment that we are in. Very expensive housing, very low income housing. We've got the school, we've got the hospital, we have all these services. We have the county jail, and we have a very large number of individuals who experience homelessness. And this is a scene that you might see at any one time. And the interesting thing is that it may shift and change, because if the police run the people away that are housed, that are living on the street, they will actually go to another setting. But a day or two later, they may be back right here again. So it becomes really important for us to take a really close look at, so who are the homeless? A number of years ago, a colleague and I went outside and decided we wanted to actually talk to folks and take pictures. So we took this set of pictures, and there were about 14 or 15 different photos that we took, and having the opportunity to talk to people to get a sense about who they are. And it was an eye-opening experience, I think, for us as we were getting to know the people who were there, understanding the challenges that people have, and understanding that homelessness comes from so many different places. We went back about a year later, and we took another set of photos of individuals as well. And this time we brought people inside of a facility and had longer conversations with them to get a sense about who they are. The important thing around these photographs is that the photographer who took them, who is an incredibly talented man, decided that what he did not want to do was put the people in the context of where they live. There are people who told us, well, I can't tell that they're homeless. And that's just the point, because many individuals who experience homelessness are like all the rest of us. They have been challenged for any number of reasons. And the basic issue around homelessness is that people don't have adequate place to live, that housing is either too expensive, or because of some conditions that are happening in their lives, they are not able to have a consistent place to live. When we think about homelessness, we think about them in probably three different categories. Those individuals who are chronically homeless, meaning individuals who are on a continuous basis chronically, who are homeless and may live on the street or may live in one of the shelters. Individuals who are episodically homeless. These are people who during different periods of their life may experience homelessness, but then there are periods when they actually have a place to live. And maybe because of job settings or maybe because of health concerns, they become unhoused. And then there are those individuals who are temporarily or transitionally homeless because of maybe they were in an abusive relationship and they just don't have a place to live now. Maybe they lost their job and they don't have a place to live. The issue of homelessness becomes even more complicated when we recognize that this is not just about not having a place to live, but we also have a big opioid crisis. I went back and looked at some data on the kind of issues that we experience with opioid crisis, and recognize that across Massachusetts now we have about 133 overdose deaths in Massachusetts monthly. This is actually down. We have seen a decrease in the numbers because of a number of activities that they have tried to put in place. So we are seeing about 133 individuals. And at this time, the primary factor that we are exposed to dealing with our opioid crisis is fentanyl. This has changed from various times. It used to be heroin. But now it's fentanyl. I also looked at some data at some other places and checked out Florida's data, since you are in Jacksonville. And Florida has had about 150 to 200 individuals who experience overdose deaths monthly. I looked at New York. New York experiences about 185 deaths a month. And then I also looked at Jackson, Mississippi and the state of Mississippi, where they experience about 26 deaths a month. So different parts of the country experience different amounts of deaths concerning opioids. I also looked at the city of Jacksonville, and there was not information per se about the number of deaths, but indicated that there are about 117 calls that come in related to exposure to drugs. So I say all of that to say that drugs become a major issue as we are thinking about dealing with individuals. And when you combine drug usage with homelessness, with mental health concerns, you have an incredibly complicated picture. So what happens with the neighborhood? I've told you now about how complicated our neighborhood is, that we now have a group of individuals who are experiencing homelessness, who are in and about the neighborhood, who we walk in and among and are with at all times. So at any one time in our neighborhood, you will see litter, you will see needles that are on the ground, you'll see a lack of cleanliness. Even though the city makes every attempt to keep the area clean, we know that when the people are living on the streets, sometimes they have no place to put their waste but in the street. There's some amount of panhandling that happens at the intersection, so it's very likely that if you stop at the stop site that someone will ask you for money. We have encampments, so we have tents that are up in the area. You will often see people actively using drugs in the area, as well as not only using drugs, but also selling drugs. And then, of course, as I've mentioned, there are deaths that occur as well. Their big question then is, all right, so what do we do about it, and what are the challenges for us? The mayor of our city, Mayor Wu, a few years ago when she became mayor, actually said that we had this new level of public safety and wanted to actually do a number of activities to address the issue of homelessness. So one of the things that she was able to do, because there was money available, is that they built these small cottages. And there are cottages that were built for about 150 individuals. This worked fine until the money ran out. And so these cottages are no longer available for for people. But for a few years, these cottages were available. There is also another area where we have a large hospital that is possibly going to be redeveloped so that there will be a place for individuals to go. We are Like many projects, we have no idea what's going to happen with this particular one, but it is being studied and considered for redevelopment, for providing services for people who are unhoused. There is another hospital being constructed just adjacent to all of the hospitals that I just mentioned to you. The area where Stephanie and I work, has the public health school. It has a set of hospitals, the Boston Medical Center, and this is another hospital that is actually being built in the area that will provide chronic care and also provide for services for people who are in the criminal justice system. This is literally across the street from where we work. There are considerations of building another center for dealing with recovery for individuals who are experiencing substance use disorder. There are many people who come up with any number of issues and any number of solutions that they believe need to be built. But it becomes very complicated to do any of these kinds of things. And so many of the things that I've told you, we either start and we stop, or we are in the process of thinking about, and the recovery campus is one of those things that is actually being considered. And finally, I want to just mention that it's not only important to think about how you deal with the population directly, but then also thinking a little bit upstream. So what is it that we need to do in order to address the issue of rents? Because Boston is one of the most expensive places to live in the country. One of the things that's certainly been considered are rent control programs or rent stabilization programs. We used to have rent control or rent stabilization in Boston and in a couple of other communities, and then that went away. And now there's consideration that this should be done again, and there are policies that are being considered for reestablishing rent stabilization programs across Massachusetts again. We'll see if it actually happens. There are many people who are for it. There are equal number of people who are against it. I brought this particular photo only to say that the issues that I'm talking about are very complicated. This was a hearing that happened just a few weeks ago when individuals from the neighborhood came to talk about the problem. These two people happen to own a restaurant. They own a Cuban restaurant that is just a few just within the area that I've been talking about. And they talked about the problems of what happens when customers come to their restaurant and they are surrounded by individuals who are homeless. So on the one hand, you have the businesses who are concerned. On the other hand, you have individuals who live in the various housing that are there, who are concerned about individuals who are homeless, who are walking in and among their neighborhoods, and who many times will need to use the bathroom in front of their yards. On the other hand, you have individuals who are at our school. Our students walk in and among the population. We have the businesses that are concerned. We have the residents who are concerned. We have the government leaders who are concerned. We have our students who are concerned. We have many individuals across the city who are concerned. And so I leave you with just the idea that there is a kind of an unhappy ending for everybody, that there is no good solution for the individuals who are unhoused. There's no good solution for the individuals who are living in the neighborhood. There's no good solution for individuals who are walking in and among. But I give great amount of credit to the leaders in our community who at least have conversations about it, who at least are attempting to address the issue. But homelessness in Massachusetts, like homelessness across many other parts of the country, is incredibly complicated. And I'll leave it right there.
Uh, Thank you so much, Professor, for your insights. And I would now like to welcome Dr. Stephanie Ettinger de Cuba to share her presentation.
Great. All right, give me a second. Oops, I have to click on 2 seconds. There we go. All right. So this is very much related to what you just heard about, but really thinking about it more from, oops, sorry, I'm trying to, more from the perspective of like kind of zooming out to sort of 30,000 feet, but we'll come back to some of the themes that Harold talked about. First, I want to actually, sorry, let me just make our heads smaller so they're not covering my screen. So just kind of zooming out to, if it sounds like many of you are public health students, so you have heard of social determinants of health or social drivers of health. These just briefly are the non-medical factors that influence our health outcomes. So this is all the sort of conditions where we are born, play, grow, work, live, age, etc., and how they impact our health. I really like this particular infographic because I think it really kind of conveys the message strongly that these social drivers of health are the majority of what actually shapes our health. And often people think about healthcare as what shapes our health, but these sort of community conditions are really a much bigger driver of our health. And when you add in the physical environment, it's about half of what that green on the right that is driving our health. And so socioeconomic factors, community conditions, those obviously relate to economic stability, which is what I've spent a lot of time thinking about in my sort of public health career, and particularly thinking about children in that. Certainly thinking about like the impact of poverty on child health and development, but then sort of zooming out to families, because children obviously are in families. So what's the employment quality and stability that's available to their parents? How does that in turn affect family financial resources? And how does that in turn shape medical and financial hardships, like whether people are able to even afford care or other needs? Just kind of staying at this sort of, 30,000 foot level for a little longer, how we think about where the interventions that we might design. Harold gave a couple or multiple, good examples of ways that people could think about intervening in the problem of homelessness matters. And so when we're upstream, you might have thought you'd heard this term upstream, downstream before. So this is a nice visual, kind of gives it to us here, where if we're upstream, this is typically where public health is trying to work, and we're trying to change those community conditions. We're trying to address structural racism that is often the cause of those community conditions being in place in the first place, if they're negative ones. Thinking about sort of what's the data that we're collecting that helps us make decisions about those conditions, and what do we need, sort of what is the structural underpinnings, right? And then at the midstream level, this is where we're starting to address people's social needs. This is more the human services side of things. So helping people get access to housing, helping people get access to food, utilities, whatever else it is, employment supports. And then sort of the downstream is the very one-to-one individual things like, individual healthcare. Thinking about housing instability in this way, the things I'm going to just briefly cover each of these because, but I think it'll tie back together nicely, and hopefully we can have a nice conversation at the end, is thinking about what do we even mean when we're talking about housing instability? What are the definitions? How do we measure it? How prevalent is it among families? How does it impact child health and development and adult mental and physical health, and then connections to other hardships? So again, I am a child health researcher, so I think about children and families. So most of what I'm going to talk about is children and families, but you can expand out to, thinking about adults that don't have children as well. So kind of following that sort of evidence trail, housing is critical to all household members, especially children, for their physical health, for their mental health. And that starts in the prenatal period. And honestly, I'd even argue it starts even before women become pregnant, like just caring about women in general, their health generally, and how they come into pregnancy is also important. All of these sort of housing factors shape quality of life. They shape access to education and economic outcomes. Because we don't have that foundation, it's really hard to make choices that advance our health on any of those other fronts. Housing is incredibly foundational, but we also have to understand some history and some context before we talk about those things. Obviously there's more history before the 1930s, but I think sort of big macro effects, and I'm not going to go into deep detail here, but I do think this is important context, is, in the Great Depression that happened in the 30s is really sort of the birthplace of our modern housing financing system. And in the early 30s, we have the start of redlining, which were these maps that were drawn up to look at risk for home ownership and giving mortgages out. And so areas that had a high number of Black people, and also brown people generally, but Black people in particular, and immigrants, were rated as very high risk. And that's where that term redlining comes, because they were marked in red. And then you had different colors for different kinds of risk. And that in turn meant that those in those communities that were redlined or not were invested in or not, right? So the redline communities didn't get the same investment that other parts of the community did that were lower risk. And so therefore we start to have this big, it was already there, but even bigger division that than previously. And so we can track back a lot of things sort of geospatially back to those maps. The other thing I just want to note quickly is the GI Bill. As veterans were coming home from World War II, there was an incredible amount of assistance offered to those veterans, including assistance with higher education and home loans. And while the language of the bill itself did not have anything about race or ethnicity, in practice, how those funds were handed out were overwhelmingly to white veterans. And so if you look at rates of home ownership, you see this real divide that happens at 1944, where there's just an incredible surge in white home ownership, and that number is just like the line is just doesn't rise at the same rate among Black people, Hispanic, Asian, etc. And then the last thing I want to say is we do actually have enshrined in law from both 1949 and 1968, that every American deserves a decent home and suitable living environment. And then in 1968, we banned housing discrimination. But as I imagine you all are well aware, we have not reached our lofty goals on these fronts yet. So on sort of thinking about what do we mean when we're talking about housing, we have to think about different dimensions, and people often talk about safe, decent, affordable housing. So when we're talking about safety, the decent, that's really talking about safety and quality. So thinking about things like toxic exposures, like is there lead in your housing? Is there asbestos? And are we enforcing quality standards? Stability gets to homelessness and also some other things that are sort of a little more hidden, behind on rent, people moving multiple times, doubling up with other people. And then affordability, we're talking about the cost of housing. So the US government says that we should all be paying a max of 30% of our income for rent or utilities or mortgage and utilities. And if you're paying more than that, then that's deemed somebody who's cost burdened. And if you're paying more than 50%, then that's somebody who's being severely cost burdened. I did look up the numbers for Florida. There aren't numbers for Jacksonville per se, but Florida has the 9th highest housing wage, meaning that this is one of the states on average across the state, you need one of the highest wages to actually afford a 2-bedroom rental. You'd need to earn $37.27 an hour to afford a 2-bedroom rental. And at minimum wage, you'd have to work 115 hours a week to afford that rental. So, Boston is certainly as Harold said, one of the most expensive markets in the US, but Florida is also up there. And the last thing is location. So thinking about what does your environment look like, right? How dense is it? Are there green spaces? Are there heat islands? Is everything covered in cement and it's like heat radiating off the pavement? Is there transportation, food access, et cetera, et cetera? So these are sort of like what we think about when we're thinking about housing, and then also, again, in turn, its connection to health. So I want to spend all night on this, but I think just as sort of an overview of the ways that housing quality relates to health. So there's definitely a whole group of things that relate to the nervous system and cognitive and organ damage, reproductive system damage that result from toxic substances and exposures. So I'm sure people have heard about the sort of harm of high blood lead levels that can cause cognitive delays in children, nervous system issues, etc. Certainly also indoor air quality and lead are other things to worry about in this realm. Is indoor air quality is more and more becoming a topic of conversation. It's sort of a newer area in this world. And in pregnancy, it's a real danger. It can cross the placental barrier, can drive higher rates of miscarriage, stillbirth, and infertility. One of the often people, when they hear about housing quality, people think of this category, respiratory category, so the pests, mold, damp, and the differences in indoor temperature and the ways that relates to asthma, how often people have an exacerbation and need to use their inhaler, be hospitalized, etc. But it can also really drive school absences of kids that have asthma. So therefore, not only are they not feeling well because they can't breathe, but then they're also missing out on education, which means that they can fall behind, which becomes obviously a real problem. And then infectious diseases, thinking about whether a house or an apartment is well ventilated. We all got a really good lesson in ventilation and water and sanitation and the importance of those during the pandemic. And why crowding is such a problem. So we're all reminded about those things. And then, even without COVID, there's just sort of general respiratory, infectious respiratory diseases and gastrointestinal infections that can happen when people are too crowded together and inadequate water and sanitation. And another category here, the last one I'm going to talk about is mental health. It's sort of something that people sort of forget about when talking about housing quality, but housing quality is very much related to our mental health. Living in poor quality housing can really drive depression, stress, family conflict. And there's some really interesting, although very sad research that looks at the quality of housing and caregivers' mental health, and not only so the impact on them and that on their children, but then how that leads them to disconnect from support systems like schools, teachers, pediatricians, so that could potentially help them. And then lastly, for each, we know of some work that others have done of looking at housing quality is that for each additional housing problem, it's associated with 43% greater odds of children having poor health status. So basically, the more problems, the worse children are off. This image I use for a lot of different things, but also for housing. I think the thing people hear about and sort of see and sort of inherently understand that is damaging to health is homelessness. So not that people necessarily understand in great detail and complexity the way that Harold, you just presented it, but that they're sort of aware that that is a problem and that that would not be good for people's health. But I think there's sort of a lot under the surface as well. And some of these I've mentioned, being behind on rent or mortgage, being overcrowded or doubled up, moving multiple times in a year, and then also evictions are a huge issue as well. So I'm going to detour and talk very briefly about my research team and then come back to some of the other research just to give you some context of where the data is coming from. So I lead a team called Children's Health Watch. We're a research and policy network. We're headquartered at Boston Medical Center, and we have research sites in Boston and then also in Arkansas, Minneapolis, and Little Rock, Minneapolis, and Philadelphia. Sorry, I'm mixing states and cities. And our goal is really to achieve health equity for young children and their families by advancing research to transform policy. So we're very deliberately sitting at this intersection of research and policy and really trying to take a holistic, sort of multidimensional view of the ways that all of these, conditions drive child and family health, and then bring that into the policy world. So all of our data comes from interviewing families of very young children who are being brought in for care at hospitals in those 4 cities. We used to also be in Baltimore. These are kids under the age of 4. So just to kind of give you some context of where this is coming from. So this is some research we did a few years ago looking at child and caregiver health outcomes by housing instability circumstance. So the orange is behind on rent, the gray is multiple moves, and the blue is homelessness. So these are compared to stably housed families. You can see that for all of these, that there's greater odds of children being hospitalized, being in poor health, having developmental risks, their parents being in poor health, and very high odds of their parents being depressed. So one thing I want you to take away from this is, yes, that this is definitely related to health, but also that those orange and gray bars are in many circumstances as high or higher than the blue bars. So yes, homelessness is very bad for children and their families. And so are these sort of more hidden kinds of housing issues. And they don't necessarily get enough attention, I think, in policy. So that's some of what I want to talk about at the end here. And similarly here, this is the same, but looking at other types of hardships. So families struggling to access food. So that's food insecurity. Energy insecurity is utilities, struggling to pay for utilities. Foregone care is health care, not getting health care because you can't afford it. And then the last one on the far right is health cost sacrifices. So this is families that paid for medical care, and now they're struggling to pay their rent or their utilities or whatever other basic need. So again, more than the numbers themselves, I want you to take away that the behind on rent and multiple moves families are having as hard or a tougher time than our families who are homeless, with meeting their needs. Everybody's doing poorly, but these things are just as bad in these other groups, and so then I think deserve some attention. So the National Survey of Children's Health took our questions and incorporated them into their survey. So this is the first time we've had nationally representative data of housing instability across the US. And in 2022, working with that team, we published this paper and found that there were 17% of children across the US were in housing unstable families. And the vast majority of those were families that were behind on their rent or mortgage, and smaller, but obviously important numbers that were struggling with multiple moves and homelessness. And lots of caregivers, about 10% of caregivers that were worrying just generally about housing stability, even if they hadn't already become housing unstable themselves. Another sort of extreme form of housing instability that then, of course, can lead to homelessness is eviction. And if you haven't read this book, I strongly recommend it. It's called Evicted. It's by Matt Desmond. It won the Pulitzer Prize a few years ago. Really insightful and some upsetting story, but or not story, it's research, but it's I think really important and insightful. One thing that came out of this book, though, was research that this researcher did, was demonstrating that our rates of eviction that we are sort of formally recognized are the court evictions, right? Court involved, but they were only about half of all evictions. So when he surveyed people, he found that half of evictions were actually informal, people just being kicked out of their housing with no court involvement whatsoever. So he then helped us adapt some of his questions into our survey, and we found the same thing. Our families, about half of them that reported that they had been evicted, about half of them had been informally evicted. So again, no court involvement. So really, when you see numbers for eviction, you really need to multiply by 2 in your head. And evictions actually are really tightly related, as you can imagine, to health risks. So we find this is not our research, as other people's, but it kind of works in both directions. That if you've been evicted during pregnancy, obviously that's an enormous stress, and that can actually precipitate preterm birth. So there's much higher risk of preterm birth if you get evicted during pregnancy. And then it works the opposite direction as well. If you have a low birth weight baby or a preterm baby, you're much more likely to be evicted. And why is that? Babies that are low birth weight and preterm typically have to be in the NICU, the newborn intensive care unit, and that requires parents to be there at all hours of the day. Sometimes they lose their jobs, or they're just not able to work and bring in income. They can lose, and then therefore lose their housing. And so it kind of need some solutions on both ends. This is our work looking at early childhood, found that kids who were in families that had been evicted were more likely to be in poor health, have developmental risk, and more likely to be hospitalized when they came to the emergency department for care. So basically, they were so sick they had to be admitted. Also, mothers were much more likely to be depressed, and families were struggling with a host of other needs and being able to meet their basic needs. And then some newer research is also showing strong connections with child depression, that children are much more likely to be depressed if their families have been evicted. One thing that I also want to note is how traumatizing eviction is, not just for the families themselves, but also for people around them. And this research came out, I believe, last year that was about African American women who were pregnant, who were living in areas that had differing rates of eviction filings and judgments. So people being like landlords submitting and asking for their renters to be evicted, and then whether or not they actually were approved or not. And the places that the mothers that were in areas with higher rates of eviction judgments and filings were much more likely to have preterm or low birth weight births and mental distress, even when they were not themselves being evicted. So I think just sort of like that community level trauma is really real. And needs attention. And then this is somewhat obvious, but I think also important to note that there's ripple effects out from all of these things, from all these different kinds of housing instability. This is some of our research showing that when families are forced to move for cost-related reasons, they're much more likely to have disruptions in their public benefits. you can imagine, the letter gets sent to the wrong place, the phone is disconnected, whatever it is. And just if it's a stressful, urgent move, you may not have all your papers in order and all those sorts of things. And so we found that families were much more likely, 44% more likely to be disconnected from SNAP, WIC, or Medicaid if they had cost-related moves. And there's the various reasons are listed there on the slide. And then I've sort of mentioned this already, but the housing insecurity's most very frequent travel companion is energy insecurity. And that's people struggling to pay their utility bills. And there are sort of populations that are really at risk health-wise with energy insecurity, either being too cold or too hot. So too hot in summer, too cold in winter. Children and infants for sure, seniors, and anybody really with obesity or a chronic disease, although it's harmful for everyone. And it's a little different depending on the age of the person. So in early childhood, you're thinking about, overall health being worse, hospitalization risks, and developmental delays. In childhood and adolescence, asthma exacerbations, poor sleep, depression, externalizing behavior, so like acting out, having trouble at school. And then in adulthood, again, overall health, mental health, chronic disease exacerbation. And in some more extreme cases, mortality. We hear cases every year of, someone who got too cold in winter, too hot in summer, and ended up dying. So that is very serious. And energy insecurity and food insecurity are very tightly related because much like the rent, there is no one knocking down your door saying to pay your food bill, but there is, your electricity can get disconnected, you can be booted out of your housing if you don't pay for those bills. But so people typically squeeze their food, and there's this term heat or eat that is sort of well known in this world, and we're now more and more seeing cooler eat, that people are struggling to pay for cooling in the summertime with our changing climate, and therefore cutting back on their food. The rent eats first is a phrase out of the book Evicted that, kind of, I think, gives you that sense of it. And sometimes the utilities eat first, too. And this is some of, again, our research showing the tight interconnection between energy insecurity and food insecurity. So these are folks who are struggling with energy insecurity, and these are odds ratios of food insecurity. So basically, the bottom line is families are much more likely to be food insecure if they are also energy insecure. These are just some headlines. This is going to be a bigger and bigger issue. We're having more and more extreme weather, so energy is a really important issue alongside housing that we need to be thinking about, and again, can precipitate an eviction and therefore people becoming homeless. So also important from that perspective. It costs our country a lot of money to not take care of people. So this is some work we did a few years ago, looking at costing how much we pay for health care for children and for mothers who are housing unstable. This does not include men. So obviously these costs are far higher if we included men. And we found that over 10 years, it would be $111 billion that we could have invested elsewhere. On the good news side, and getting out of policy and solutions, and then we can stop and have some discussion, is on the right-hand side of this is some interesting research from other folks that looked at when people actually got into affordable housing, they were 5 times more likely to spend money on healthcare, or had 5 times the spending on healthcare, i.e. they were taking care of themselves finally, and were spending more on food because they were now able to not dedicate at all to housing. They had lower Medicaid costs, more primary care visits, fewer ER visits, and basically fewer accumulated medical expenses that can get people into real trouble with their credit and debt and things. Rental assistance is vital in this puzzle. There's MTO, you may know, is moving to opportunity. This is a big study that was done several years ago. That was a little problematic. It gave people subsidies and asked them to move to a different neighborhood, a higher opportunity neighborhood, but actually ended up having all these sort of social disconnections. And so there was kind of mixed findings. But other studies have that are more straight rental assistance have demonstrated that really that injection of support helps people stabilize their housing, have food security, have better diet quality, improve mental health, less ED use for children with asthma, miss fewer school days, lower healthcare expenditures, etc. So all the things that I was talking about were the problems, like rental assistance really makes a difference. And during the pandemic, we also had emergency rental assistance, and some places have continued that as sort of these fast infusions to prevent eviction. And sometimes it's really not a lot of money that people need. And the research out of that really demonstrating that people were able to catch up on rent. They were less likely to incur more rent-related debt, and having difficulty paying expenses, and unsurprisingly, better mental health. The asterisk there on the bottom is about child health because I keep hoping I'm trying to get this study funded to look at emergency rental assistance and child health and continue to hold out hope and add to this slide. So what can we do? I think certainly there are housing solutions, bridging that gap between rent and income with rental assistance, obviously expanding the stock of affordable housing. That's an ongoing challenge in pretty much every part of the US. Stabilizing families through emergency assistance, not letting people get to the point that they are actually becoming homelessness. And some of that is about access to counsel. So requiring and funding representation in eviction court. More than 90% of landlords are represented and only about 6% of renters are represented. It's really disproportionate. And then also getting innovative, thinking about flexible funds. People know how to spend their own money. They don't need people to tell them how to spend their money. And guess what? When they have money to spend, such as with these tax credits and guaranteed income and other things, they actually spend a lot of it on housing and stabilizing their housing. And guess what? They do better. This is a quote from a study I did on the advanced child tax credit, a mom that was talking about when that was rolled back. You might remember this from the pandemic that we had an advanced child tax credit, a bigger infusion, and then we rolled it back. And she said, everything's increasing besides the amount of money you have. Guaranteed income has been spreading across the US. I can talk more about it in questions if people want to talk about it, but the thing I wanted to say is not a blue state only thing. There's red states as well that are also working on guaranteed income, and it's working in a variety of situations and often really tied to housing and supporting people's stability. So we can innovate. There's tax credits we can think about. There's guaranteed income we can think about. There's healthcare systems that can be investing in the neighborhoods that are around them. Businesses that could be helping to invest in housing for their workforce. And, all these things that I've already said, that stable housing improves health, this improves our workforce, allows people to take care of their needs, and sort of unlock their potential. And when we have more voices, we have more power. So I hope that between the two of us, we've convinced you all to work on these issues. So I'll leave it there.
Thank you so much, Dr. Stephanie, and thank you so much to both of our speakers for such a powerful presentation. I just want to add a little thing to here, like as someone who had grew up in India, I've seen firsthand how housing challenges affect people in like many different ways. And I feel overcrowding was the main issue in India. Like even though like informal settlements and very common and they created a lot of stress among families. But I just want to add up to Cox's presentation that I am doing my PhD at BU, and when I came to US, I realized that even though the systems are different, many of the core issues were actually very similar. Like people still, struggle with affordability, long wait list, and finding stable, safe housing. It is like it really shows the housing issues are like universal and they have huge impact on health and stability and even daily life everywhere. That's what I feel. And thank you both for your presentation. It was a wonderful presentation.
I just had a comment. I sent a book title for you to look at. It's by Dawes, Political Determinants of Health. You're probably familiar with it. I started giving lectures on this topic before the pandemic and had we looked at the models, but had no idea how much politics would rear its ugly head, and it's just we can talk all we want about the on the street issues, but unless we start advocating, uh, negotiating, and to achieve better results politically, it's the problems are very serious. And of course, what you've described is the pre 2025 world. But now with all the money being removed uh, uh, from research, the changes in political dynamics, come to Florida and you'll see what's happened to public health, so that commercial interests can do better. The local drop-in emergency room is a for-profit entity, and therefore don't give any money to public health departments. I mean, it just goes on and on and on. So I urge everyone to pay close attention to what's happening right now and to speak up and get your voice heard on these issues.
I think that's really true. And I think it is very different state to state. I mean, it's pretty much, I mean, it's horrible everywhere. And it's particularly horrible in some places. And Florida's got a particularly tough time. But I think what you're doing with the work you're doing is what needs to happen is bringing people together, educating people, helping them understand. Um, and like you say, building that awareness and the coalitions to push back, because I do think this pendulum will swing. Maybe I'm like just an internal optimist, but I think the pendulum will swing. People are getting angry at and realizing, unfortunately, I wish it wouldn't take all the harm to happen for people to actually wake up, but sometimes that is what needs to happen.
Yeah, maybe when enough children die from measles and enough people get other diseases, things will start to change.
I hope that it doesn't take that. Uh, Certainly, the idea of losing funding is a major concern. It is important for people to understand about how to advocate and the kinds of things you need to do in order to advocate, and that you can do it. But I worry not only about losing dollars, but I worry about the misinformation that actually is there.
Right.
That the fact that there are now so many pieces of information that you don't know what to trust. I saw something recently that said the CDC says. It used to be that if I saw something that said the CDC says, I would perk up and I would think, okay, so what did the CDC say? And now what I find myself saying is, well, is that right? And needing to question what the CDC is actually saying, and the kind of misinformation that the CDC is now allowing itself, for whatever reasons, to actually do is as harmful as losing all of the money that we are losing.
That's right. Yeah, definitely. It's people don't know who to trust or where to turn.
Hmm.
Yeah, absolutely. And we have a Surgeon General that is he claims to be educated in medicine, but the things he's doing here are just horrible.
We've been watching what your Surgeon General has been doing, and leads lots of questions
Yeah.
Yeah,
about what the interests are, and
yeah,
leaves lots of questions.
yes, yes.
But then we also have a Secretary of Health and Human Services that makes us do exactly the same thing.
Yeah,
Right. That's
yeah, yeah. Questions from the audience? I have one that
Hi,
oh, go ahead.
sorry to cut you off, Dennis. But can you guys hear me all right?
Yes.
Yeah.
All right. Um, Thank you for your presentations. It was really informative, and as a public health major in North Carolina, I definitely have like learned so much about housing this year as an incoming junior as well. But I was wondering, like, as a public health major who's like learning and getting exposed to all these issues, I think something really important in like countering these problems is like evaluating our implicit biases. So I was wondering, like, as people who have like a lot of expertise in this topic, like what's one way that we can like in our everyday life like limit our implicit biases from wanting to help like houseless individuals and also like push for policies that better like protect them or like mitigate like this issue in like so many of our homes and states.
You know, one place you start is just by even acknowledging that you have them.
Mhm.
The fact that you even have that language and that you understand what that means is important, and it can help to drive a lot of what you do. So just being aware of your own thinking and keeping your eyes open, get exposed to different kinds of ways that people are experiencing problems or the way people live, and those biases become not always obvious. It's not always so obvious, but it certainly is important in knowing that there are those things that can get in the way that will actually drive the way you think, the way you act. But I think that continuing to expose yourself, continuing to expose yourself to the way other people live, to the various different folks who are in your community. It's stepping outside of your comfort zone and going to some of the festivals of some of the communities that are in your state and in your area will be a really good way of just understanding who's out there, who's being impacted, what are they doing, how do they live, and then you get to ask yourself, and how do I feel about it?
Mhm.
And you will begin to discover what some of those things are. But I think the most important thing is continuing to expose yourself, continue to actually understand that everyone is not like you. Whoever you are, whatever the things are that make you you are, everyone is not like you. That there are many people who have other ways of thinking, other ways of acting, other ways of behaving.
Yeah, all of that, and also talking to people, asking them what their solutions are, right? Like it doesn't, yeah, people in policy organizations, people in government don't necessarily know. It's really important to ask the people who are experiencing the problem what they need and how they would solve it. That's really where all this guaranteed income and direct assistance work came from, was people said, I just need the money and I will know how to spend it. And guess what? When people did studies, they knew how to spend it. Like it's not rocket science. But that's where that came from.
So
Thank you so much.
let me come back to the questioner. You you asked us about how you began to deal with issues around implicit bias. What's your answer to your own question?
That's a good one.
That's a great way to follow up with this question. Recently we're um in one of my classes we were assigned to uh evaluate our implicit biases, and I remember like just grabbing a burger with a friend, and then a houseless like individual walked up to us, and my friend asked me like, what did your like when as you're growing up, like what did your parents tell you like how to like treat like houseless individuals? And I kind of like
Mm.
thought to myself like, yeah, like what did they teach me? Like I know growing up, like at least for me, like my parents told me like, oh, like don't like walk around by yourself, and like like if you're gonna give money, like maybe you should give them like groceries or like something else like that's more like tangible than just money, because like who knows what they'll do with money. But even then, like I was also like really conflicted because like as a female, like I also think about like being unsafe, and like it's like kind of like I want to be able to like counter like stereotypes and stigma about houseless individuals, but then I'm also like conflicted about like being unsafe and like just being in dangerous situations. Um, but I think in general, to counter implicit biases, like I've learned that one, like you guys said, like just embrace being uncomfortable, like ask those questions, like directly involve yourself with like the community members. And then also just like I think another like really simple thing is kind of like one, like call myself out and then find a different association so I can kind of like change the way I view things by actively like reflecting in the moment when I catch myself doing those things.
Kudos to you. You you
Thank you.
you are you're doing
Agreed.
the right thing. You get a big check mark. I particularly was interested in what you were saying about when people are panhandling. I mentioned in the area that we work in that there are a lot of people who are panhandling. You stop on the street, people will ask you for, some money. And I listen to people talk about how so first people don't know how to respond to that. On the one hand, people want to just bow their heads and keep going because they don't know how to respond. There are some other people who actually recognize that, oh, someone spoke to me, so I ought to speak back to them. But then there's the question of, so should I give money or should I not give money?
Mm,
And my answer to the give money or not give money is it's up to you. If
mm,
you decide that you've got the money to actually share with someone, go for it. There will be people who say, well, but they're going to use it for, and I have to stop people right there. People will use the money for what they decide they need to use it for. If their thing is to use it for drugs, then okay. If their thing is to use it for whatever, food, whatever it is that they're going to use it for, once you decide to give the money, it's up to them. I think
right.
that's really the important thing that Stephanie was talking about in cash assistance programs. That you learn, people will actually figure out what they need to do with the money themselves. That we don't need to guide them on what to do with the dollars. And we also don't need to be judgmental about what they decide. If you decide to give money, then I say go for it, go for it. If you decide not to give money, that's fine also. But recognize that it's up to that individual to use those dollars. So it's a really interesting thing about how we think about being around the populations of people who are different than ourselves, whether they
Mm.
are unhoused or whatever, different race, different culture, whatever that thing is. We should be. Well, I'm kind of going off on a different tangent, Stephanie.
No, but it's relevant.
Okay. So I do have one question, like for both of you. So how does the housing problem affect people differently based on their race or income? And what should we focus on to make things more fair?
Mm. Do you want to go first, Tyler,
No,
or do you want me to?
I'm gonna let you take it
Oh,
on.
okay.
Yeah.
Yeah, I mean, I think I kind of, in a longer presentation, I would have gotten more into it, but I mean, just the starting place of who is at risk is different because of our history as a country, right? And the structural racism that is baked into our system about who gets access to what, who gets the education, the high quality education, who gets the access to jobs and that sort of thing. So there's very much there's a lot that's sort of I mean, not, I don't want to be deterministic about it because obviously there's always people who, grow up in a very low income neighborhood and do well, right? But also like looking at sort of population and likelihood, if you grow up in a neighborhood with few resources and, schools with very few resources and not great housing quality and lots of people around you are struggling, like your chances are higher of not doing well in life. And who does that tend to be in our country? That tends to be Black and brown people. That's just being straight about it, right? Because those communities have lacked investment. And so I think sometimes with our sort of approach in this country to like the pull yourself up by your bootstraps, people equate that skin color with, well, you just haven't tried hard enough and you don't didn't deserve it. But it's really like bigger systems at issue of like who's actually getting the housing assistance that might be available, who's getting the support to access those systems that might be available. So anyway, to your point, I think being really intentional in the design of any supports or interventions is really, really important to think about where it's being delivered and how it's being delivered and what are the sort of unintended barriers that could be in there. And just to give a concrete example, which isn't housing per se, but I think just sort of as a brief example, um, like with the advanced child tax credit, we had this, rollout across the country. It was universal credit, amazing, fantastic. We're going to make it so easy. We're just going to directly deposit in people's accounts that file taxes last year. Well, guess what? A lot of folks didn't file taxes last year because they didn't have to. It was perfectly legal. They didn't earn enough to file taxes last year. And who are those people? Predominantly, those were Black and brown people. And so, who didn't get the advanced child tax credit? That's who didn't get it. And could they still get it? Yes, they could, but they had to file a form, and it was like a whole rigmarole for them to get it. So, even there were people who did do that, but then there were lots that didn't. And so, yet again, we had this system where we had this supposedly universal support going out that yet again didn't reach the people who most needed it, right? So I think that's the sort of thing we have to be thinking about in policy design and really being intentional and to your point, sorry, I've forgotten who's asked the question about implicit biases. People are like, fantastic, tax credit, roll it out, you know? So, but we didn't think about all those other people and how they were going to be able to access it. So I think in housing, it's the same thing. If we're going to design a housing support, we have to be really careful thinking about, well, how are people going to get access to it? Who's going to get access? Who's left out now? Why are they left out now? And really break that down a lot more before a support gets designed. I don't know if that helps.
I really appreciate what you were saying. And the thing that I started thinking about was how housing shifts depends on where people live, kind of depends on who's out, where rich people want to live. So, for instance, when rich people want to live in the city because it's close to the services, because it is and I say rich, but I mean people with sufficient resources want to live in the city because it's where it's close to the events. It's close to where the restaurants are. It allows them to walk wherever it is that they want to. Given that we live in a walkable city, then that means rents go up in those areas. So who has to move? The poor people.
Yeah.
They get pushed out. And then when rich people or people with more resources decide that, I really need more space. I need to have more open air. I want to live out where, in the suburb areas. Well, okay, so they move out there. So who has to move? The people tend to be Black and brown people again, have to move into the city because they can't afford to live out there. So wherever folks with resources tend to want to live. Other folks actually have to shift and move. I live in a neighborhood. I live in Dorchester. I live in a neighborhood that is shifting right now, and the rents are going up just sky high for the area that I live in. So who's moving? All the Black and brown folks. They don't live here anymore. They're needing to actually shift. It's an interesting dynamic about what happens and how we see this move that occurs, and depending on who has the resources and where they want to live, and other people who don't have to get out of the way.
Yeah. And so you could think about policies that would help support those people to stay in place, right? In an ideal world, we could come up with things that would, counteract those forces. I don't think we've come up with good solutions on
I
that
don't
front
think
yet.
so. I mean, and there's certainly been lots of conversation about rent stabilization programs,
Right.
which have pluses and minuses
Yeah.
for rent stabilization. And I don't know what's going to happen in Massachusetts right now. There's certainly some measures, but it wants to actually do the whole state as opposed to just individual communities. So not clear whether that policy will go anyways.
Well,
And then I think, yeah, yeah, Dennis, you can go ahead.
I was just going to say we're 15 minutes over our usual
Mhm.
hour, and we always like to end at 8 because we're afraid
Yeah.
people won't come if they if they get sucked into an hour and a half or 2 hour presentation. But it's been wonderful to have both of you speak. And Muskin, anything you wanted to say to
Yeah, no,
close?
Joy, I just want to thank you again to both of our speakers for sharing their time, expertise, and perspective. And even I think housing is a complex issue that affects health, stability, and opportunity. And your insight help us better understand these challenges and path forward. I also want to extend a special thank you to Dennis, our supervisor, and to our intern coordinator, Sadia, for their guidance and support in making this event possible. And finally, thank you to all of our attendees for joining this important conversation and for being a part of this town. Thank you so much.
Thank you. I echo that. Thank you, uh, Dr. De Cuba and Dr. Cox. Really appreciate your being with us this evening. And I urge all of you to subscribe to our YouTube channel and watch more videos on topics that are focusing on areas of the social determinants of health. That's what we do. So have a great evening and a wonderful holiday to all of you, and look forward to having you again with us at some point.
Thank you so much.
Thank you. Happy Thanksgiving, everyone.
Thank you.
Happy Thanksgiving to everyone.